Good day everyone, this is John Lalmoni from Bibliobazar. Welcome to today's presentation where we will be discussing total knee replacement surgery. We will cover the disease conditions leading to this procedure, the types of replacements, causes, risk factors, symptoms, treatment options, surgical techniques, and the nursing care essential for recovery. Total knee replacement, also known as knee arthroplasty, is a surgical intervention aimed at replacing the damaged surfaces of the knee joint with artificial components. This procedure is commonly performed for severe arthritis, including osteoarthritis, rheumatoid arthritis, and post-traumatic arthritis, which cause debilitating pain and functional limitations. The primary causes of joint degeneration include chronic wear and tear, autoimmune diseases, prior joint trauma, and genetic predisposition. Risk factors such as aging, obesity, previous surgeries, and participation in high-impact activities can increase the likelihood of needing a knee replacement. Patients who require this surgery often experience persistent knee pain, swelling, stiffness, and limited mobility, which significantly impact their daily lives. Advanced cases may present with deformities such as bow-legged or knock-kneed postures and joint instability. When conservative treatments like physical therapy, pain medications, and intra-articular injections fail to alleviate symptoms, surgical intervention becomes necessary. The procedure involves removing the damaged bone and cartilage from the knee and replacing them with prosthetic components made from metal alloys, ceramics, or durable plastics. Total knee replacement can be categorized into partial or total replacement based on the extent of damage. With the advent of robotic-assisted surgical techniques, precise alignment and placement of the prosthesis are possible, leading to better outcomes. Post-operatively, patients typically experience significant pain relief, improved joint function, and enhanced quality of life. Post-surgical nursing care is vital for recovery. Nurses manage pain control, wound care, and monitor for complications like infections, blood clots, and joint stiffness. They also provide guidance on physiotherapy exercises to regain mobility and strength. Educating patients about lifestyle modifications, such as maintaining a healthy weight and avoiding high-impact activities, is essential for the longevity of the prosthetic joint. A multidisciplinary approach and individualized care plans contribute to successful recovery and patient satisfaction. Thank you for joining today's session. Don't forget to subscribe to our channel for more videos like this and visit bazarbiblio.com for notes and free PDF books. Thank you.